The information provided on The Forever Young Show by its host or sponsors is for educational and personal alternatives. Statements have not been established by the Food and Drug Administration. They are not intended to diagnose, treat, cure, or prevent any disease.
Welcome to the Forever Young Radio Show. Over the past 2 decades, we have had the opportunity to serve and help so many listeners. We do that by bringing on respected educators in all fields of health and wellness. We pride ourselves on keeping consumers in the know about our ever-changing healthcare system and ways to support the body. Each week, with the help of our special guests and experts, we have one goal in mind, and that's to ensure every listener has the most up-to-date information on ways to support all aspects of health. Now, here's your host.
Hello, everyone. So glad you could join us today right here on Forever Young. Whether you've caught us on our traditional radio station, Sirius XM, or any of our podcast platforms, welcome to the program. It's been our mission here for well over 2 decades to inform and educate every listener on healthier lifestyle options and good quality science-based information. If you'd like to learn more about the show, you can do so at foreveryoungradio.com. Again, that's foreveryoungradio.com. There you can listen to well over 375 podcast episodes, some wonderful articles that we put on there, courtesy of Dr. Mark Stangler in many cases. And also, you can learn more about our affiliate show, americasnaturaldoctor.com. Now, on this episode, we're going to focus our show all about collagen. I think there's a lot of talk about collagen, especially over the last couple of years. There's a lot of market hype and different things like that. People have a lot of questions. Do I need collagen? Can I replace it? Which form do I use? So we brought the brain of knowledge on to help us to do that. America's Natural Doctor, Dr. Mark Stangler, NMD, MS. He is one of the most respected integrative doctors in America. In fact, he was voted the 2019 Doctor of the Year and 2021 Doctor of the Decade by the prestigious International Association of Top Professionals. Patients from around the world travel to Southern California to be treated by Dr. Stangler at his acclaimed Stangler Center for Integrative Medicine, where he specializes in treating complex medical conditions and helping his patients enjoy the robust health they deserve. His secret is all about the balanced approach to health. And again, like I said, you can learn more about him at americasnaturaldoctor.com, and nose around not only at the articles, but he's also the author of over 30 books. Dr. Mark, thank you so much for joining me today. So great to talk to you.
Hey, Kelly, good to be with you again.
Yeah, it's always great. I appreciate when you carve out the time so we could pick your brain on these really hard topics, because you do it so easy for the listeners to understand, Dr. Mark. So always a pleasure to have you with us. The Stangler Center for Integrative Medicine is helping so many people across the country, whether it's hormone balance, weight loss, weight management, cancer issues that they're dealing with. So I hope listeners will learn more. But on this show, collagen, Dr. Mark, we're hearing about it. Hype, do we need it? What is collagen? Tell us a little bit more.
Well, sure. Collagen is really essential for our bodies. We couldn't live without it, and our bodies just wouldn't hold together. It's really the glue, if you will, that's found in our muscles, our bones, our skin, our blood vessels, tendons. It's a component of our digestive system. It's like a glue that keeps our tissue together. So very, very important. And you're right. I mean, collagen, it has been really popular, I'd say, in the last 5 to 10 years. And originally when a lot of the collagen shakes came out and collagen products, I was a little bit skeptical because a lot of these products didn't have any research or studies behind them. But the fact is, our body needs collagen. It's essential. It's very important, as I talked about, for all these major body systems. Our body does make collagen, has the ability to do that. It does take amino acids from foods to make collagen. But yes, there are collagen products that people can take which have good science behind them and have been shown in studies to help. So collagen, if used correctly, both in the diet and as in a supplement form, it really can be helpful for people.
Yeah, and that was one of the things when we were preparing for the show. When we hear about collagen, people are wondering, what is it? Is it a protein? Is it an amino acid? Does it have a different type of amino acid that we have never heard about? Can you talk a little bit about that, Dr. Mark?
You're right. Well, collagen really is a type of protein, and it's made up of amino acids, which are the building blocks of protein. And so collagen really is a mixture of many different types of amino acids. Amino acids they call essential types. You have to get in your diet, non-essential types your body can make. So like you said, it is a protein. Now there's 3 main amino acids that our body uses to make collagen. We have proline, we have glycine, and there's also isoleucine. And these are amino acids our body will use to make collagen. There's other ones as well. Like I said, there's chains of amino acids that make up collagen. But our body really needs these essential amino acids. We do need the proline, the glycine. We also need glutamine as well. And so our body uses these amino acids to make collagen, and we get those in our foods.
Yeah, absolutely. But unfortunately, do you think people are eating properly? I know we do, but with the Western diet, are they getting enough of this in their foods, in your opinion?
Well, good question. I think there's a couple things. People are eating such processed foods, fast foods, so a lot of people do not get, the amino acids in the quantity they need. And then we have all the people who have digestive problems, who have malabsorption problems, who then aren't getting the amino acids into their cells and their tissues to make collagen too. So that definitely can be a problem. And then we have other accessory nutrients our body uses to make the collagen, like vitamin C, for example, zinc. So if people aren't getting a good balance of foods, like fish, for example, eggs, legumes, fruits and vegetables, then yes, you could definitely have problems making collagen.
Again, voted Doctor of the Decade a couple of years ago. What, 2021, Dr. Mark?
Yes, 2021, that's correct.
And if that wasn't enough, you decided to go back to school after your 26 years of successful seeing patients and get another 2 letters after your name, MS. What's that, Dr. Mark?
It's just initials for my name, Mark Stengler.
Well, that's what I thought.
Yeah, no, I got a master's degree in human biology. Yeah, I got that not too long ago, and I'm actually, interestingly, I'm about probably 1.5, 2 years away. I'm finishing a PhD in health sciences too. So I like to keep learning.
Yeah, the more you learn, the more you can help your patients. I mean, this is a real passion for you for many, many years. And when we talk about research on this show, Dr. Mark, we're not talking about something that is buried under a rock. You're doing research each and every day and implementing that and then sharing it with people in a condensed form, again, in those articles you have on americasnaturaldoctor.com. But before the break, Dr. Mark, I wanted to pick your brain. We started talking about collagen peptides. Give us the skinny on that.
Well, essentially collagen, when we refer to the term collagen, it's referring to proteins made up of many different amino acids. Now, peptides we have smaller units of amino acids. So you're breaking it down, so to speak. So collagen peptides are groups of amino acids that the body then uses to make collagen. Now, in terms of supplement forms, the way to really use collagen is to use formulas which have been scientifically studied to use these peptides, these smaller chains of amino acids, so that the body can absorb them into the bloodstream and get them to the tissues. I mean, collagen is such a large molecule. By itself, you really absorb little to none through the digestive tract. And that really has been the knock on a lot of collagen products throughout time. It could be that collagen itself is good for the lining of the digestive tract because it's interacting with the digestive tract kind of locally. But in terms of then getting the collagen and the units that make up collagen absorbed through your small intestine into your bloodstream, then go into your cartilage, go into your skin, go into your hair, that's been the challenge. So from what I've seen, a lot of products don't have the science behind them where the collagen is broken down into these peptides so that the body can absorb them, get them into the bloodstream. In our small intestine, you can't absorb large molecules. It's designed such you absorb smaller molecules, and that's based on how our digestion works. So when you're taking a supplement form, really you need products which have collagen peptides, which have been broken down, usually by processes called hydrolysis, using water, hot and cold water, to break them down into the smaller peptides, the collagen peptides like you mentioned. And then our body can absorb those peptides, and then the body will put those peptides back together to form collagen in our cartilage, in our skin, our hair, our eyes, all these important areas of our body.
A question we get so often, Dr. Mark, and again, I love that our listeners are inquisitive, is does the body naturally make collagen?
Yes, absolutely. Our body uses high protein foods, especially ones that contain the amino acids glycine, proline, and hydroxyproline to make collagen. And we find that in foods such as fish, poultry, meat, eggs, some dairy products, legumes, even soy. You find these amino acids. So yes, our body is designed to make collagen from these amino acids. And Kelly, I should mention, there are some symptoms, signs and symptoms that your collagen levels are decreasing in the body. There's no lab tests that I know of that are available so people can measure how their body's making collagen. There's no blood work or anything. But basically, we know based on symptoms of what collagen makes up. So let's say your skin is wrinkling much more rapidly or sagging. You got kind of that hollow look around your eyes and face, muscle shrinkage, muscle aching. Your ligaments and tendons aren't working properly. You're getting stiff joints, for example, like an osteoarthritis, a loss of mobility of your joints. You could have like leaky gut syndrome or irritable bowel syndrome, not good digestive function. These are all signs that your collagen production probably is getting lower, which does happen with aging. It certainly happens with aging, and so you may benefit from getting foods with collagen or supplements with collagen.
Wow, leaky gut, Dr. Mark? I mean, all those other ones are, obviously tall tale signs, but again, leaky gut, that's big. I know that you recently just put out a book on people dealing with leaky gut. You've seen it with your patients for a long time. There was a large gap there in the market of really educating people on it. How can people learn a little bit more about the real truth about leaky gut, what you put out?
Yeah, I do have an ebook on it at americasnaturaldoctor.com. But what's interesting in there, Kelly, I did document based on published research that collagen actually does help to heal the lining of the small intestine where the leaky gut occurs. So one of the benefits of a good collagen product is it can help in the healing of a leaky gut or small intestine. And of course, digestion is so essential to overall body health. So I thought that was unique in the published literature.
Oh, 100%. I think so many people are suffering out there with that. I mean, not that people don't want to pay attention to the joint pain and the mobility and the stiffness and all of the other things, a blood flow issue that could really affect you long term. But I was really surprised to find out what you shared about leaky gut. I hope people will learn more on that if that's something they're dealing with. What really causes the loss of collagen in the body, Dr. Mark? Is it our lifestyle choices only, or are there other things?
Yeah, there are a few things. Certainly as we age, our body produces less collagen. That's why when we do things like take collagen supplements, we can fight against that to some degree. People who smoke definitely get much more rapid collagen loss in the body. Another thing which affects, depending on which study you look at, 50 to 75% of the American adult population has pre-diabetes or diabetes, so their blood sugar and insulin levels are too high. But when your blood sugar levels are too high, basically the glucose, the sugar, attaches to proteins in the body, like collagen, and it damages the collagen, becomes weak and brittle. And there's a fancy medical term called advanced glycation end products, but basically when you consume too much sugar, yes, it damages your collagen. Another one is our skin. As I said, collagen is like the glue that makes up our skin, so sunlight damage, excessive sun exposure can damage the skin, although we should get some sun exposure. There's been some research showing that high cortisol levels leads to the breakdown of collagen in the body, and who doesn't experience that? Lack of sleep when the body regenerates at night could be an issue. And then lastly, people who have autoimmune diseases. There's mixed connective tissue diseases, rheumatoid arthritis, lupus. All these things do lead to a breakdown of collagen.
Wow, I'm thinking about the last couple of years, the pandemic, all of those things you've listed for us to kind of look at. I think we've seen an uptick in all of that. People are having more stress, they're having higher cortisol, aren't sleeping as well. We've seen, and you've shared on many shows, Dr. Mark, that autoimmune disease is on the rise, and people are dealing with that a little bit more after the pandemic. And we know people have made different choices throughout it, maybe smoking or dealing with the things to manage stress. So again, something that we can kind of look at. And we're not a Debbie Downer show, so let's talk about some of the benefits if people are obtaining and making more collagen, what they can kind of look for versus these negative issues that they're dealing with.
Right. Well, a lot of my patients, all the female patients, certainly are happy with a good collagen product because they do see improvements in their skin and hair. And we do know that the research shows that collagen is very important for the formation of healthy skin and hair. So there are studies with certain collagen products where when you take it at the right dose, the skin can look firmer, increase smoothness, and it just helps with our cell renewal of the skin. The same thing with hair. It doesn't help so much with hair growth, is what I found, but it does help with the quality of the hair, like people who have brittle hair. The other major thing we see a lot of good feedback on, and there's good studies on it for collagen extracts and different types of hydrolyzed collagen, is helping with osteoarthritis. So people have the stiff and painful joints. And so mobility, pain in the joints, a good collagen product definitely helps with osteoarthritis and degeneration of the cartilage, breakdown of ligaments and tendons. So that's one that people use a lot for. I mentioned before, again, very unique in that collagen can help heal with a healthy gut and healthy intestines. So if you're the kind of person who's been prone to leaky gut syndrome, maybe irritable bowel syndrome, colitis type conditions, malabsorption, collagen could be helpful as part of your overall protocol. Muscles, we talked about how collagen is involved in making your muscles. So if you work out a lot, it could be that collagen could support with tissue repair, or if you're just noticing over time you just can't maintain proper muscle tone, it could be helpful in that way as well. And then there's other things you really can't see, like blood vessel health, the outer covering of the eye, like the cornea. We know collagen's involved in the formation of that. Nail health, definitely it's involved in helping to form healthy nails. So quite a bit of overall benefits from collagen.
Yeah, quite a bit, and many jobs that it does each and every day that it's responsible for. DNA, RNA. Let's talk about that a little bit before we head out to the break.
Well, yeah, of course, DNA and RNA is what controls how our cells and our organs and all that work. And so having the right proteins, having the right amino acids, which you get in collagen, your body does use for healthy cell machinery and healthy cell function. So this is all very important in terms of, like I said, the overall functions of collagen are quite wide-ranging.
You've actually put an article together that they can go and read under the health breakthroughs at americasnaturaldoctor.com, so they can kind of go through this, Dr. Mark, and learn a little bit more about collagen. Because as we're talking about this, we want people to understand that not all collagen is created equal. You can go to America's Natural Doctor, click on the health breakthroughs. And the cool part about everything that Dr. Mark puts out there is scroll to the bottom and look at the references, because he's doing the hard work to find these studies to share them with us. And it's just a wonderful thing to be able to share with your friends and loved ones. We'll be right back after the break. Welcome back, listeners. Again, having a great conversation with America's Natural Doctor, Dr. Mark Stangler. Dr. Mark, thank you so much for joining me again. I really appreciate when you come on the show and you help educate the listeners on these big topics.
Well, thank you, Kelly. And, you always cover the things that people are wondering about. I mean, like I said, collagen has been a big thing the last number of years, but people are certainly confused how to really use it.
Well, even me. Here's the thing. I mean, I've been in this health game for 25 years almost, but I was almost ashamed of myself. I knew that there was different types, but primarily, I was always taught in the old school, there's two types. There's type 2, that helps with the joints, with the fluids and the lubrication. There's 1 and 3, that normally helps with the skin and the nails. But I was really surprised that there's, 28 different types of collagen. So let's talk about that, Dr. Mark, because I'm going to need some education.
Well, yeah, it is very interesting. It's another proof the body's very intelligently designed. We now know there's at least 28 different types of collagen in the human body. 28 different types. So we have types of collagen, we have subtypes of collagen, and again, we wouldn't be able to have a body without them. Very, very important, these specialized, proteins. Now, the main ones are types 1, 2, 3, 5, and 10, even though there's 28 different types. And about 80 to 90% of the collagens consist of types 1, 2, and 3. So, and out of those, type 1 makes up most of the body's collagen. But again, you need all those other different types for all these specialty structures we have in the body, whether it be blood vessels, whether it be the cornea, the covering of our eye, all these intricate features in our body. We need all these different types of collagen. So when we use supplements, mainly we're using types 1, 2, 3, 5, and 10, because that covers all the major things people are using it for: the skin, the hair, the joints, the cartilage, and all that. So that's what really good products typically carry.
Do you mind giving us a little bit of an overview on the different types and maybe what their function is outside of 1, 2, and 3?
Okay, sure. Well, type 1, as I said, it's the most abundant. It's also the strongest type of collagen found in the human body. And you find it in things like tendons, ligaments, but it also is involved in our organs, coverings of our organs. It's also found in our skin, the dermis layer of our skin. You also find it in bones. A lot of people are surprised to find out that our bones require collagen. And not only does it give bone strength, but flexibility as well. Our bones do have flexibility. We also find type 1 in the digestive tract, as I spoke about. But, the type 1 collagen is very interesting, very, very strong, but it still has an elasticity to it. So, for example, that's what you'd find in your skin. Grab your skin, pinch it, move it around. It's hard. You can't grab your skin and just tear it off with your fingers. So it's very unique. You got the elasticity, but you've got the strength to it as well. Another intricate design from God. Then we have type 2 collagen. Now that's very specific for cartilage and connective tissue. So people that have the osteoarthritis, like of the knees or other joints, type 2 really is a primary cartilage builder. Then we have type 3 collagen, and we find that also in our skin, but you find it in the organs as well, and it gives firmness and flexibility. In addition, you find it in our blood vessels, so things like in the blood vessels, in the heart, and other organs. Now, type 5 is a type of collagen we need to make surface cells. So that would be like the skin, for example, again. But you find it in hair strands. You also find it even in a woman's placenta. You remember the organ that develops in the uterus during pregnancy and provides nutrients, oxygen to the baby, and removes waste products. So type 5, it's pretty versatile. You find it in skin, hair, even the cornea of your eyes. And then the last major one is type 10. And as I was mentioning before, you need it for new bone formation. Now remember, our bones are constantly remodeling themselves. So besides the calcium, the magnesium, the D, the silica, you do need collagen for proper bone formation. It's also involved in cartilage, what we call articular cartilage. So again, it's a little bit versatile as well. But those are some of the main types of collagen that we can use therapeutically in supplement form to help people.
Let's talk about some of the sources of collagen out there, if you don't mind, Dr. Mark.
Yeah, when it comes to like food sources of collagen, really the collagen itself, you're going to get it from animal products, really. So the ones that are very high in protein and collagen would be beef, chicken, fish, and interestingly, eggshell membranes they have shown in research. So like in our product, we do use from eggshell membranes, hydrolyze or break it down. It is a good source of collagen. And people can get collagen from food sources like bone broth as well. So these are different sources of collagen. Now, plant foods aren't really good sources of collagen per se, like they can have small amounts, but they do provide the synergistic nutrients your body also uses to make collagen. So foods high in vitamin C, like berries, for example, or broccoli. Foods high in zinc, say like pumpkin seeds or mushrooms. We do need some of these synergistic nutrients combined with the peptides that make up collagen for the body to make it.
Wow, so goodness, if you're a vegan, I mean, how are you getting proper levels of collagen?
Well, it could be an issue. Like I said, if you have some of those other predisposing factors, or you're very active, or maybe you've got joint products, you've worn them out. I mean, it may be a challenge, to get enough to optimize your collagen.
Wow, yeah, and we don't want people dealing with that. I mean, obviously, what diet you pick for your life, what works best for you, but be mindful of this, because as Dr. Mark has shared with us over the course of this conversation, is we'd be a puddle without collagen. Think about building a house, a foundation, right? And not using any concrete or anything like that and being like, I hope it doesn't get windy. You don't want that to happen within your body. You want to be able to provide the body what it needs. We were created perfectly, but again, things change as we age. Now, Dr. Mark, what about different things? I know you had talked to us about it a little bit, but the eggshell membrane, I know that you did a skim over on it, but that was impressive to me because I'm not seeing that in many other products out there.
Right. Well, there has been research for a number of years now on eggshell membrane collagen, demonstrating it helps osteoarthritis in human published studies. And the eggshell membrane collagen does contain, that vast type 1 collagen. It also has types 3, 4, and 10. So it gives you things people might have heard about before: glucosamine sulfate, chondroitin sulfate, hyaluronic acid, as well as amino acids that support the health of connective tissue. So it provides a lot of these things we've known for years are involved by the body to make cartilage and connective tissue.
That's pretty awesome. And then you have collagen wellness. That's something that you knew there was, a void there. And you have all these patients that rely on you, Dr. Mark. You have so many patients that you see all across the country for years and years. And again, you run blood work. Now, you shared with us, there's not really a way to run blood work to really understand where you're at with your collagen. But I know when you get people on one of these really highly researched formulations, you hear back from them. What are you kind of hearing back about collagen wellness?
Yeah, what we hear from the patients generally is pretty quickly they notice improvements in their skin texture. It's mainly the women giving us that feedback. A lot of the men, some care, but a lot don't. They're using it more for their muscles and joints. But the women tell us, within about 30 days, they're noticing less wrinkles, smoother skin of the face. However, Kelly, I should say one of the other reasons I use collagen wellness with patients, those patients, usually over 55, 60 years of age, where they're losing the collagen in their skin, and they just get a light bump into something, they get the bruising because they have such thin skin. So it's a
Yeah.
great product for that, and I've done that with people for quite a while to support, that problem as part of aging and the thinning of the skin. The other thing we get very good feedback on is for arthritis. So people who have the osteoarthritis, the stiffness and aching of the joints, reduced mobility, works very well, for that problem. And then third, we'd certainly get reports back, again, more from the women in terms of better quality hair and nails. So less brittle hair, healthier hair. Their nails start to grow like crazy, which makes sense because this is the building blocks of those, those types of tissues.
Yeah, and Collagen Wellness, the cool thing I like about it is it's created from 4 real food sources. Give us a little bit of snap on that before we go to the break, Dr. Mark.
Yeah, well, we want to get the best collagen from all the different food sources. So it has the collagen from beef, chicken, fish, and then that eggshell membrane. And so even with the beef, we're using sustainably sourced chicken bone broth as well as the beef in terms of getting that collagen, especially for the skin and connective tissue. But we also have, wild-caught fish where we get peptides from as well.
Wow. So if listeners want to learn more, it's really easy. You can either go to the weekly highlight page at foreveryoungradio.com, click on this episode, and you'll see an image and a logo to click to Dr. Stangler's website. You can click through from americasnaturaldoctor.com, or you can click directly to his store at drstangler.com. That's STENGLER, drstangler.com, and learn more about the collagen wellness and chocolate or the unflavored. We'll talk about that when we come back from the break. Dr. Mark will give us his opinion on what seems to be a fan favorite, depending on palates. But he has been so kind to give us a discount. And this is a discount in addition to the discount on his website. So if you use the code collagen, that's COLLAGEN, collagen, you'll get 15% off your order. So stock up, give it a try, share it with your friends and family. And again, if you're driving and can't write this down, all of this information is on the weekly highlight page of foreveryoungradio.com, including the code collagen to get 15% off the collagen wellness. Stay with us. When we come back from the break, we're going to talk about research and really pick Dr. Mark's brain. Does collagen and taking and supplementation, can it actually help? So stick with us and we'll talk more after the break.
At the Stangler Center for Integrative Medicine, they offer advanced healthcare screening and medical management programs to better serve you, the patient. Their mission is to optimize your health span and your lifespan. They go way beyond the dominant medical model, which is actually a sick care model. In this outdated approach, your symptoms are treated, but the root causes of your health issues are often ignored. At the Stangler Center for Integrative Medicine, America's natural doctor, Mark Stangler, will help you to take control and be proactive in managing your health, and will also help you to uncover those root causes of your symptoms with state-of-the-art lab testing, so you can get the clearest possible picture of your current health, and then some recommended targeted treatment and preventative modalities so you can achieve your long-term health goals. For a full list of treatments offered, please visit markstangler.com. That's markstangler.com, or call today, 760-274-2377. That's 760-274-2377.
Welcome back, listeners. Again, having a wonderful conversation all about collagen, understanding the different forms, what it does within the body, what research has shown to be the most effective when wanting to reach those goals during the aging process, whether it's our hair, skin, our nails, our joints, cardiovascular, DNA, RNA. I mean, it's endless, all of the jobs that it does every single day. And I like, Dr. Mark, that your collagen wellness comes in a powder form, because some people like to mix it up in their shakes, or they like to make a shake out of it. They can add any type of a mix to it, whether they want to do like an almond milk, a coconut milk, or something of that nature. What's your favorite, the chocolate or the unflavored?
I like the chocolate. Yeah, I like the chocolate.
Okay.
Chocolate has been the most, we have the chocolate and kind of like an unflavored vanilla type. So we have two different types. So people like to put it in coffee and stuff. They'll use the unflavored, kind of a little bit of vanilla hint to it. They'll use that. But we actually find most people get the chocolate flavor. Now, if you're the kind of person you like to make shakes and put berries in and all that, obviously you can do that with chocolate. It can be a little bit odd. So if you like to do that, then maybe you'd like the unflavored version.
And that's important, Dr. Mark, because like we said, people like to incorporate it throughout the day. They like the full filling they get too. It's a wonderful time, whether to start it in the morning. I know you like to exercise. bright and early, and then the first thing you normally do is have a shake right after that. So again, however people like to incorporate it, as long as they're doing it a wonderful way. And again, if you want to learn more about collagen wellness, you could go to americasnaturaldoctor.com and link to the store and learn more about it. Now, Dr. Mark, it's important for people to understand. We've shared all the stuff on collagen. We've shared about the decline that could happen during aging. Let's talk about one more time if somebody's coming and catching the show on the radio dial midway through. Collagen, how can it help if used properly with a good science-based formulation?
Yeah, well, we know that around the age of 30, our collagen production really starts to slow down. So if you're the kind of person who's concerned about or having problems with your joint stiffness, osteoarthritis, mobility problems, makes a lot of sense. It's almost like a food source of supplying that nutrition to your joints, those collagen peptides that you need for regeneration of the connective tissue. If you're the kind of person who's not happy with the quality of your skin, it seems like it's aging too fast, wrinkling too more rapidly than what it should be, or you just want to see it improved, it's a very good choice. Problems with the hair and the nails. People who have chronic digestive problems, really helps in the repair of the digestion. So yes, as we age, our collagen production slows down, so we can basically provide the nutrition to support your body's own natural collagen formation. So if you look at the research, apart from all the hype, if you look at the research with certain quality types of collagen products, absolutely, it does support, the health of those tissues and organs.
Yeah, and what I like about collagen, Dr. Mark, is there's a lot of supplements we take each day because we need it, right? We may take a multivitamin, we may take a fish oil, but sometimes we don't necessarily feel the effects of that. But knowing what a foundational nutrient collagen is within the body, I would say that people should feel the difference, right?
They really should. If you look at a lot of the studies, within 30 days, people notice a difference, even in things like their skin, which is pretty quick. People can notice a difference in their skin 30 days, certainly usually 60 days at the most, skin and nails and hair and your joints. 1 to 2 months, you can notice a difference. Now, if you have a more severe problem, maybe give it a good 3 or 4 months, you'll notice even more improvements. But what I like about it, it's really a natural approach, because what you're doing is you're providing the nutrition, the building blocks of things like your collagen, like your connective tissue, like the fibers in your skin, and your hair, your nails. So it's like a super nutrition for the organs of your body.
That's great, because my next question is going to be probably the emails that are going to come if I don't ask you this. How much collagen should someone take each day?
Well, to get a therapeutic amount, usually we're looking at 10 to 20 grams of collagen, which is, 1 to 2 scoops of what we're using in the collagen wellness products. Now, remember, Kelly, one of the problems you can run into with capsules or tablets, which I use a lot with patients, but in terms of the amount, to get in with the type of collagen I'm talking about, to get all the mixtures, to get that amount, that's very difficult to get in tablets or capsules. 10 to 20 grams, that'd be a lot of capsules or tablets. So the powder, in 1 scoop could be like 10 to 20 capsules, for example, maybe even more. So, the powder makes sense in terms of what we're talking about right here. There are certain products which we use where you're just getting one type of collagen, maybe like a type 2 type collagen, undenatured, you're just using for the joints themselves, doesn't help the other things. You could use things like that in a supplement form. There are studies, but generally, using this powder does have its advantages. So, like in the morning, I take 1 scoop a day. Most patients, I'll use 1 scoop a day. If people are really serious problems, maybe severe arthritis, maybe for a few months I'll have them take 2 scoops a day just to speed things up. But 1 scoop a day, it works well for most people.
That's great, Dr. Mark. And in the article that you put out on collagen at americasnaturaldoctor.com, do you outline that? Maybe what people should look at when they're trying to figure out how much they should be consuming each day?
Yes. Yeah. We give the basic recommendations in that.
That's great. And people can learn more right about collagen wellness. We'll put a link at the bottom of that article. So if you want to just link directly to there, you can. Dr. Mark, what do you think? What are the final thoughts of what we've been talking about today, the importance of collagen and why we need it?
Well, I think the science is really clear. As we get older, even past the age of 30, our collagen production decreases, and that makes us more susceptible. Aging skin, brittle, unhealthy hair, nails, digestive issues, and certainly problems with our joints, connective tissue, and muscles. So if we want to approach it from a nutritional perspective, supplying quality studied collagen products, and they're peptides, they're hydrolyzed absorbable form with human studies, makes a lot of sense to prevent these problems and certainly to help reduce these problems if they're already existing for people. And very safe. I mean, safety, there really are no safety issues with using collagen products like our Collagen Wellness. I mean, unless you have like an allergy to, say, fish or chicken or something like that, that'd be really the only type of situation that would be a major, warning for people.
Yeah, and I'm glad that you point that out, Dr. Mark, because we want people to get benefit. That's why we work so hard to not only you formulate these products in most cases, or you find the raw material, you work with, a really good reputable source. Because listen, Dr. Mark, being the leader of the Stangler Center for Integrative Medicine, if you're sharing these things with people and it doesn't work, they're not coming back. And I think like you've had patients that have been with you for over a decade. So obviously you're doing something right, Dr. Mark.
Well, yeah, thank you. That's a good point. Practice 26 years. Patients seem to be pretty happy. So, we can look at studies, which is important. A lot of products don't have them. We do. But in the end, I need not only the studies, I need to see it working with people in real life, and that's what we see. So those are the two criteria that I judge things on.
Yeah, and that's great. And again, if you want to learn more about collagen wellness, you can do that at americasnaturaldoctor.com by linking directly to the store or reading the fantastic article that Dr. Mark put out on collagen if you want to learn more and you think maybe there's something we missed. In addition to that, goodness, go and help yourself to all the other articles that are on there. You'll be busy. Dr. Mark has put a lot of content out there, wonderful YouTube channel as well, where you can go and get great information, and check him out on Facebook or Instagram at Mark Stangler, putting out great practical tips on why you need to stay hydrated, why your adrenals may be not functioning, or why you have hormonal issues. Really just a wonderful source to get great information. And don't forget to sign up for his newsletter there at America's Natural Doctor. I can't believe it's still free of charge, Dr. Mark. You do so much good work for the public out there, and we greatly appreciate it.
Thank you. I appreciate it, Kelly.
Well, one more question for you, Dr. Mark, and I know we didn't plan it, but are you taking new patients? I know that normally you have quite a wait there, but I know every time we do a show with you, people are emailing us, how can I learn more about becoming a patient of Dr. Mark? Do you do telemedicine? Is there a way? I live in Iowa. Dr. Mark is located in Encinitas, California. Can you tell us a little bit more about that, Dr. Mark?
Yes, I do take some select new patients. I mean, people that are serious about their health and their conditions I work with. Yes, I will take new patients, and we see them in person in the office. There's also telemedicine. And then we do have, my wife, Dr. Angela, she sees patients too. So, she's another resource where people can get in as new patients as well.
There's tons of shows we've done with her as well. You can learn more about that on foreveryoungradio.com. Great shows on magnesium, CoQ10. And I tease her all the time, Dr. Mark, that she's my favorite Stangler. So I hope you don't listen to those shows. I don't want to hurt your feeling.
No, that's good. That's good. She's kind of a powerhouse in being interviewed, isn't she?
She's awesome. She's just a wonderful, funny person with such a passion. You both have such a passion for helping your patients and becoming detectives. I mean, it's not like you just see somebody and you see them for 5 minutes and say, hey, work on this. You give them practical tips to be able to really change their life. And again, you can learn more about either of the Stanglers at americasnaturaldoctor.com or at the clinic site, which is markstangler.com. And the pronunciation of the spelling is very easy, Stengler, Stangler, or you can call 855-DOC-MARK. Dr. Mark, always a pleasure. I hope we'll get to talk to you again in the next couple of weeks or even the next month.
Hey, thanks a lot, Kelly.
Have a happy and healthy week. We will catch you next time if you get lost along the way. ForeverYoungRadio.com.